Magnesium, the mineral you trusted. The one you took every night before bed because someone told you it would stop the toe cramps. And those capsules sitting on your nightstand right now. Your body may not be using them the way you think. You felt it again last night. 2 in the morning. That sudden, sharp seizing in your toes. You reached down. You pressed. You flexed. And by the time it let go, you were wide awake. Heart pounding. Wondering why this keeps happening when you're doing everything right. And here's the part that stays with you. You had blood work done. Your doctor looked at the numbers and said you're fine. Normal range. Nothing to worry about. So you went home. Took another magnesium capsule. And the cramp came back anyway. Most seniors are told that toe cramps mean one thing. You're low in a mineral, probably magnesium, and you just need to take more. That's the story. Simple, clean, easy to believe. However, and this is where everything changes. The NIH Office of Dietary Supplements states clearly that serum magnesium levels have, and I'm quoting their language here, little correlation with total body magnesium levels or concentrations in specific tissues. Less than 1% of your body's magnesium is even in your blood. So when your doctor checks that number and says it's normal, that test may be telling you almost nothing about what's actually happening inside the muscle that just seized your toe at 3 in the morning. That gap between what the blood test shows and what the muscle actually has is the gap that keeps seniors guessing. And it's the gap almost nobody explains. The system isn't hiding this from you on purpose. The information just never caught up. The advice stayed simple while the science got more complicated. And you deserve the update. My name is Dr. David Collin, and I need to be honest with you before we go any further. This is for educational purposes only. Always discuss changes with your own doctor. What I'm about to share with you comes from peer-reviewed research and named institutions. But your body is yours. Your medications are yours. And any decision you make should happen with a physician who knows your full picture. Now, I'm telling you this because nobody else in this space will. By the time this conversation is over, you're going to understand exactly why your toe cramps keep coming back. Even when your labs look normal, even when you're taking the mineral everyone recommends, and what the real blockers are that no one connected for you. After 60, everything changes, and most people aren't told why. If you find this helpful, and I believe you will, subscribe so you don't miss the next one. I cover what seniors are rarely told, and I want you to have access to that. Let me show you what's actually happening inside your body right now. Because this is not about one missing pill. This is a chain of events, and once you see it, the toe cramps finally make sense. Your muscles run on a system. Think of it like a lock and a key. When a nerve signal reaches your toe muscle, calcium rushes into the cell. That's the contraction. The muscle fires, tightens, does its job. But then, and this is the part people miss, magnesium has to show up to let it release. Magnesium is the key that opens the lock so the muscle can relax again. When magnesium is there, the cycle works. Fire, release, fire, release. Smooth, quiet. You never feel it. But when magnesium isn't available to that cell, at that exact moment, the muscle fires and keeps firing. That's a cramp. That's what woke you up. Now here's why this hits your toes first. The muscles in your toes are small. They're at the very end of the supply chain. If your body's magnesium is running low, or if something is blocking it from getting where it needs to go, the smallest muscles at the farthest points feel it first. Before the calves, before the thighs. The toes are the early warning system. And it's not just magnesium working alone. Potassium helps keep the electrical signal stable. Sodium helps with fluid balance around the cell. Calcium triggers the contraction. If any one of those is off, even slightly, the whole system gets noisier, more excitable, more likely to misfire. Especially at night, when you're still, when blood flow slows, when the muscles cool down and the nerves get twitchy. So the first thing you need to understand is this. A toe cramp after 60 is not random. It's not just aging. It's your body telling you that the mineral relay system, the handoff between magnesium, potassium, calcium, and sodium, has a weak link somewhere. And you can't fix a weak link if you don't know where it is. Most seniors never connect this to that. Today you will. Now, let's talk about the thing that makes this so confusing. Because it's one thing to say your magnesium might be low. It's a whole different thing to explain why taking more of it doesn't always fix the problem. Here's the reality. An analysis of NAN's data, that's the National Health and Nutrition Examination Survey, found that 48% of Americans of all ages consume less magnesium than recommended, and adults over 71 are among the most likely to fall short. That's nearly half the country, and the oldest Americans are hit hardest. So yes, low intake is real. That part of the story is true. But here's where the standard advice falls apart. The NIH also notes that magnesium absorption from the gut decreases with age, and kidney excretion of magnesium increases with age. So after 60, you're absorbing less of what you eat and losing more of what you have. The math is working against you even when you're trying. Have you noticed it happens more at night? Even when you ate well that day? Even when you took the supplement? That's not a coincidence. That's the gap between intake and delivery. And no one ever explains that gap. Now add medications to the picture. This is where it gets serious. In 2011, the FDA issued a drug safety communication warning that long-term use of proton pump inhibitors, those are the acid reflux medications like omeprazole and lansoprazole, can cause low magnesium levels. Not might, can. The FDA reviewed adverse event reports and medical literature and said it clearly. Prolonged PPI use is associated with hypomagnesemia. And in 25% of the cases they reviewed, magnesium supplements alone didn't even fix the problem. The patients had to stop the PPI. If you take a water pill, this next part matters. The NIH states that chronic treatment with loop diuretics, like furosemide, and thiazide diuretics, like hydrochlorothiazide, can increase the loss of magnesium in urine and lead to magnesium depletion. Harvard Health has also noted that these same diuretics can lower potassium, which causes muscle weakness and cramping. So picture this. A senior takes a blood pressure pill that quietly drains magnesium and potassium, takes an acid reflux pill that blocks magnesium absorption, eats a diet that's already a little low in both minerals, and then wonders why the toe cramps keep coming back. That is not a deficiency you can fix with one capsule. That's a system problem. And until someone explains the system, the cramps just keep returning. Blood may look normal. Muscle may not. Now I want to slow down here, because what I'm about to tell you changes the way you think about this problem entirely. A 2016 study published in the journal BMC Family Practice, Magnesium and colleagues, looked at patients over 60 in primary care and found that 46% reported having cramps. 31% said cramps woke them from sleep. And the main location? 80% said the calves. But 15% specifically reported the feet. These weren't rare cases. These were common, recurring, quality-of-life disrupting events. And most of those patients had been dealing with it for 5 years or more. 5 years. Think about that. 5 years of broken sleep. 5 years of shaky first steps at 2 in the morning. 5 years of reaching for a supplement bottle and hoping tonight will be different. The American Family Physician Review from 2012, Allen and Kirby, noted that up to 60% of adults report nocturnal leg cramps, and the prevalence increases with age. They also noted something that stops most people cold. Neither exercise-related cramps nor nocturnal cramps have been consistently associated with disturbances of electrolytes like potassium, sodium, and magnesium in clinical studies. Read that again in your mind. The very minerals everyone tells you to take. The research says the connection between blood level electrolyte disturbances and cramps is not clearly proven. That doesn't mean minerals don't matter. They absolutely do. It means the story is more complicated than you're low, so take more. And this is where the outdated framework fails you. The old model says, cramp equals deficiency equals supplement equals fixed. But after 60, the real question isn't just do I have enough? It's can my body actually use what I have? That's a completely different question, and most seniors have never been asked it. Your doctor never told you this, but I will. Let's talk about what this looks like in real life. Because this pattern plays out across millions of seniors and almost nobody names it. A common scenario, a senior starts getting toe cramps at night. They look it up. They buy magnesium. They take it faithfully. It helps a little, maybe, for a few weeks. Then the cramps come back. So they add potassium, maybe a calcium supplement, maybe an electrolyte drink. They're now taking 3 or 4 things, and the cramps are still there. Why? Because stacking minerals doesn't fix a delivery failure. If the gut isn't absorbing well, if a medication is quietly draining what you take, if the balance between magnesium and potassium and calcium is off, more pills just add volume to a system that isn't moving the minerals to the right place. Not random. Not harmless. Not always just aging. I want you to drop a letter in the comments right now. If you believe toe cramps mostly mean you need more magnesium, drop the letter A. If you believe the real issue is absorption, medication losses, and mineral balance, drop the letter B. I read every single comment personally. Let me know below. And now here's the part I've been building toward. Everything I just told you is real, and it matters. But there's something that changes all of it, something almost no one talks about. And once you understand it, you'll never look at toe cramps the same way again. The real issue, the one hiding underneath all of this, is not a deficiency in the simple sense. It's a mineral delivery failure. Let me explain what that means. A delivery failure is when the mineral is technically present in your food, in your supplement, maybe even in your bloodstream, but it's not arriving at the muscle cell in the right amount, at the right time, in a form the cell can actually use. The 2020 Cochrane Review, Garrison and colleagues, looked at all the available evidence on magnesium supplementation for skeletal muscle cramps. Their conclusion was direct. It is unlikely that magnesium supplementation provides clinically meaningful cramp relief for older adults with idiopathic nocturnal cramps. Not that magnesium doesn't matter, but that supplementation alone, just adding more, wasn't solving the problem in the studies that tested it. That finding should stop you in your tracks, because it tells you something the supplement bottle never will. The issue isn't just the amount, it's the delivery. After 60, your stomach produces less acid. Less acid means less breakdown of certain mineral forms, especially magnesium oxide, which is the most common and cheapest form on the shelf. The NIH notes that forms of magnesium that dissolve well in liquid, like citrate, chloride, and aspartate, are absorbed more completely than magnesium oxide and magnesium sulfate. So the type matters, not just the dose. Then there's the potassium side. Your toe muscles don't just need magnesium. They need potassium to keep the electrical signal stable. And if your potassium is even slightly low because of a diuretic, because of low intake, because of chronic mild dehydration, the muscle becomes more excitable, more prone to misfiring, more prone to cramping, even if the magnesium is there. I need to pause here. This is important. This is for educational purposes only. Always discuss any supplement or food changes with your own doctor, especially with potassium. If you have kidney disease, or if you take ACE inhibitors, ARBs, or potassium-sparing diuretics, adding potassium without medical guidance can be dangerous. Same with magnesium if you have kidney impairment. These minerals are powerful. They need to be managed, not guessed at. Now, the delivery failure has one more layer. And this is the piece that makes the whole picture come together. Hydration. Not just drink more water. Real hydration means the sodium-to-water ratio inside and outside your cells is balanced enough for minerals to move properly across membranes. If you're chronically underhydrated, common after 60, because thirst sensation decreases with age, the fluid environment around your muscle cells isn't right, and minerals can't do their job in the wrong environment. So here's the full chain. Low intake, poor absorption, medication-related losses, wrong supplement form, potassium imbalance, hydration mismatch. Any one of those alone might not cause a cramp, but stack 2 or 3 of them in a 68-year-old body, and the toe muscle, the smallest muscle at the end of a line, fires at 2 in the morning and doesn't let go. That's not a magnesium deficiency. That's a mineral delivery failure. And that's why just take more has never been the full answer. Most seniors never get this far. They manage one piece of the puzzle, but they miss the delivery chain. And that gap is exactly what keeps the problem returning. This is not age. This is something your body is doing, and we can fix it. So what do you actually do with all of this? That's what matters. And I want to be very clear about what comes next, because this is the part the entire conversation has been building toward. The first thing, and this is the foundation, stop assuming toe cramps automatically mean you're missing one single mineral. The research doesn't support that framework for most seniors. What the research supports is a system check, a full picture, not one number on a blood panel. The second thing, and this surprises most seniors, rebuild from food first, not from a bottle, from your plate. The NIH lists pumpkin seeds at 156 milligrams of magnesium per ounce, almonds, 80 milligrams per ounce, spinach, half a cup, cooked, 78 milligrams, black beans, 60 milligrams per half cup. These aren't exotic foods. They're available at any grocery store. And here's why they matter more than a pill for many seniors. Food-based magnesium comes with cofactors, other minerals, fiber, compounds that help your gut absorb it better. A magnesium capsule arrives alone. A handful of pumpkin seeds arrives with the whole support team. For potassium, think about what's on your plate every day. A medium baked potato with the skin has over 900 milligrams of potassium. A cup of cooked spinach, over 800. A banana, about 400, which is helpful but not as potent as people think. The point isn't to chase one food. It's to build a daily pattern where your meals are naturally mineral-rich, so the supply chain stays full. So to be clear, food first. Variety matters. A plate with leafy greens, legumes, nuts, seeds, and whole grains covers more of the mineral base than any single supplement can. The third thing, and this is the one most seniors skip, review your medications with your doctor. Specifically ask, could any of my current medications be affecting my magnesium or potassium levels? If you're on a PPI, that's a conversation. If you're on a loop or thiazide diuretic, that's a conversation. The FDA and NIH have both flagged these connections. Your doctor can check, but they may not bring it up unless you ask. And the fourth, if your toe cramps keep coming back despite normal labs and despite your best efforts with food and supplements, ask your doctor a different question. Instead of, do I need more magnesium? Ask, what might be blocking absorption or shifting the balance? That one question changes the entire direction of the conversation. It moves you from the old framework, more pill, same cramp, into the real one. Most seniors never connect this to that. Today you did. And I want to leave you with one more piece that ties everything together. The real takeaway, the thing I want you to carry out of this conversation, is this. After 60, the question is not only do I have enough mineral, it's can my body actually use it where my muscles need it? That is the question that changes everything. When you understand that question, you stop guessing. You stop stacking. You start asking the right things. And you start getting answers that actually match what's happening in your body. Before I let you go, there's one more thing. And this might be the most important part of everything I've said today. If your toe cramps are only on one side, if they suddenly got worse, if they come with weakness, swelling, numbness, or persistent pain that doesn't ease, stop blaming minerals alone. The Mayo Clinic advises seeking medical care for cramps that cause severe discomfort, are associated with leg swelling or muscle weakness, or don't improve with self-care. Those patterns may point to something beyond nutrition, circulation, nerve damage, or another condition your doctor needs to evaluate. Don't wait on that one. If those signs are there, bring them up. That's not a supplement conversation. That's a medical conversation. Now, you understand why the mineral itself may not be the whole story. You understand the delivery chain, absorption, medication losses, mineral balance, hydration, supplement form. And you know the questions to bring to your doctor. But now that you know all of that, there's something else happening, something that quietly blocks relief even when your food choices look right. The timing of when you eat these foods, what you pair them with, and how certain common combinations actually interfere with the absorption you're trying to fix. Most seniors are making those mistakes right now. Today, I cover exactly that in the next video. Watch it now.